NG tube insertion or nasogastric tube insertion is a procedure we do frequently. In addition to nursing, does this procedure as well. It basically does two things. One, we usually use it in bowel decompression, so in the setting of like a small bowel obstruction, for example, or we may use it as an alternative form of nutrition, among other indications. So I'm just going to group in NG tube, Dobhoff, OG, all these things, okay? So it's really important that when you understand why you do what you do, you need to understand that, yes, we do this procedure to help with nutrition or decompression, but we also need to know what happens if we misplace the NG tube, for example. So the two main complications of NG tube insertion, which would typically be like, hey, if you didn't use a core track or you accidentally went into the lung, maybe the patient doesn't have a good swallowing or gag reflex, which is the indication here why I placed the chest tube actually, is because the patient had trouble, they didn't have that swallow reflex. So when the person that was inserting the NG tube, they actually placed it in the lung. And so the two main indications or complications, for NG tube insertion is actually one, you can cause a bleed, you can nick an artery, you can subsequently undergo alveolar hemorrhage, or two, you may develop a pneumothorax, and that's what happened here. So prompt, evaluation is you want to pull that tube out, and then you want to get a picture, a chest X-ray immediately after, and see what the lung's looking like. And in this case, the patient ended up having a pneumothorax, which is fine. You can place a chest tube and, treat the pneumothorax that way. If there was a bleed in the lungs, you may need to go in and do bronch. You may need to have interventional radiology depending on how bad the bleed is, if they decompensate, all of this. So this is really important to understand that when you place the NG tube, just something as simple as trying to get an alternative form of nutrition, you need to understand the two main complications of NG tube insertion, which is bleed and pneumothorax. Please like and subscribe, guys. If you like this content, if you like these type of videos, it really helps me continue to do what I do, which I love doing, making videos for you guys. And if you guys have any questions, just let me know in the comments. All right, guys, see you in the next video.